clear evidence. Again, 128,000 people studied here, and 1.5 times, exercise is 1.5 times as effective as therapy and medicine. So what kind of exercise do you need to be doing? Hey, this is Brooks from brooksbrowncoaching.com, and in this video I'll be discussing exercise and depression. Now, I always put a medical disclaimer in my videos, but I just want to reiterate, because of the content in this one, that you should not stop taking any antidepressant medication that you are currently taking based off the information in this video without consulting your prescribing physician. Stopping antidepressant medication cold turkey can result in very serious side effects up to and including suicide. So again, although the information in this video is very encouraging, do not stop taking any antidepressants without first consulting your prescribing physician. Now, a lot of the information that I'm going to talk about today comes from a study out of the University of South Australia, which included about 128,000 people. They looked at a bunch of different studies from all over the world, and what they found was exercise alone was about 1.5 times as effective in treating depression as psychotherapy and pharmaceuticals combined. So I want to talk about why that might be and what are the effects that exercise is having on your brain that's really improving the symptoms. So to start off, let's get an idea of how many people depression affects. So 1 in 8 people worldwide is thought to have depression. That's about 970 million people. And treatment of depression costs about $2.5 trillion a year. Now, that cost is expected to go up to about $6 trillion by 2030. And events over the past few years have increased the number of people with depression pretty rapidly. Isolation is a big contributor to anxiety and depression, and there's been a lot of that in past years. So let's talk about why exercise maybe is having this type of effect. So what is exercise doing? And 2, at the end of this video, I'm going to tell you the types of exercise and the duration that really had these effects, because there seems to be differences based on intensity and even duration of exercise. So we'll discuss that here at the end. So what is exercise doing? Well, physical activity is doing a lot of things to your brain, and there's some other just basic kind of habit and psychological effects, but just right off the bat, it's really affecting your neuromolecular mechanism. So there's things that's going on in your brain where a lot of the processes happening in the brain are controlled by little chemicals that are going through different parts of the brain, and they're being excreted by different parts of the brain and picked up by certain parts of the brain through different synapses and all this good stuff. We're not going to get super deep in the weeds on that, but what I want you to know is there are a lot of things that the kind of brain chemistry changes when we exercise, both in the short run while we're exercising and in the long run. So one of those things, you might have heard this word, neurotrophic factors. It's getting popular in some supplementation, but what a neurotrophic factor is really proteins or peptides in the brain that are contributing to the growth and maturity of neurons. So the things that are kind of talking in our brain, those neurotrophic factors are keeping those little places healthy. So these communicating parts of our brain, they're keeping them healthy. And that's one thing that is increased by exercise. So these neurotrophic factors are increased in the brain. Additionally, we have an increased availability of serotonin and norepinephrine. Now, serotonin is probably familiar to you. This is the chemical in your body that helps us kind of relax and contributes to happiness, not to be confused with something like dopamine, which is typically thought of more as a reward chemical or really a seeking chemical. It's actually a chemical that makes us seek reward, but those are kind of thought of as interchangeable. Serotonin, on the other hand, you can kind of think of more as a chemical that contributes to more maybe contentness or fulfillment versus, a real intense reward feeling. It's just an overall sense of well-being. So exercise can increase that availability in the brain, which is where we need that serotonin to be taken up for us to feel that happiness, that relaxation. Now, in depression, that chemical process is kind of dysregulated. We're not having that uptake in the brain, and that serotonin maybe is taken up in other places in the body, so it doesn't make it to the brain, which is why one of the most commonly prescribed antidepressant drugs is something called a selective serotonin reuptake inhibitor, or an SSRI. These are drugs like Celexa, Prozac, Lexapro, Paxil, and Zoloft. Those are probably some familiar names in there. So what they're doing is they're keeping other parts of your body from taking up that serotonin in hopes that serotonin makes it to the brain and can exert its effect of helping you have this kind of happy, relaxed, contented feeling. Unfortunately, those drugs come with significant side effects. I'll get into some of those here shortly, but just know that one of those things that exercise is doing is making that serotonin more available in the brain. Now, one of the ways that we think that's probably happening is that exercise increases the concentration of tryptophan in the brain. Now, I feel like a lot of people have heard of tryptophan during Thanksgiving, where people say, oh, well, that's why you feel tired after you eat turkey, because there's tryptophan in it. Well, there's tryptophan in most protein, and as well as some other foods. But when you exercise, you're converting probably some of your branched chain amino acids into tryptophan, and that tryptophan will then turn into serotonin. So the exercise is not making the serotonin per se, but it is making the things that makes the serotonin, and it's making that more available in the brain. So that's one way we think that serotonin is probably affected by exercise. That's probably also why you start feeling some fatigue. You feel a little tiredness after you exercise because of that increased concentration of tryptophan in the brain. So that's one really good thing. Additionally, I mentioned norepinephrine is increased availability in the brain. Now, norepinephrine, also called noradrenaline, it does a lot of things in the body, as it's the case with most things that you've realized if you've been watching my videos. Most chemicals in the body do quite a few things, and we'll just focus on a couple. But norepinephrine really is responsible for making you go, encouraging you to take action. Now, if you have been around someone with depression, or if you experienced depression yourself, you realize that it is very hard to make yourself do stuff. It's very hard some days just to get out of the bed, and the idea of doing a task might seem overwhelming. Well, this is probably partially due to these low levels of norepinephrine availability in the brain and body. So exercise can increase that availability in the brain. Now, there are some drugs called SNRIs. These are selective norepinephrine reuptake inhibitors, again, reducing the uptake of that norepinephrine in other places in the body so it can be available in the brain. These are drugs like Cymbalta, Effexor. There's a few others that may be familiar to you or that you might currently be taking. That's what that drug is doing. It's trying to make more of that norepinephrine available for your brain. So it's also, that norepinephrine is also doing things like affecting your formation and retrieval of memory, and it helps you with focus, and in high levels it can increase your restlessness and anxiety, which both of these chemicals in really high levels start to have some unusual effects as well, which some people experience if they're taking a pharmaceutical like an SSRI or an SNRI, and then additionally taking some extra supplementation to try to increase their serotonin levels or increase their norepinephrine levels. You can start having some unusual side effects on the upper end of those, like restlessness, anxiety. With high serotonin levels, you can get some shakiness all the way up to things like seizure. So again, as you've heard me say many times in my videos, everything in balance. So additionally, exercise is playing some role in the hypothalamic pituitary adrenal axis. Now, if you watch my video on cortisol, you know how important that axis is, and cortisol being secreted and then circulated in your body with that stress hormone. Exercise plays its own part on that axis, which helps mitigate some of these maybe unwarranted stress release. And kind of like a final little thing that we kind of contribute to exercise is a reduction in systemic inflammation. Now, you can go look at some of my videos about fat concentration on the body and what that's doing to your hormones, or anything where I talk about visceral fat. You know that you have parts of your body that are producing inflammation, interleukins, all throughout the body, and exercise can help reduce that, as well as reducing things like visceral fat, which are responsible for pumping out some of these inflammatory markers. So kind of a double whammy there of a benefit. So, another thing when I talk about the hypothalamic pituitary adrenal axis. So one thing that exercise is doing is exposing your body to stress. Now, we think of psychological, mental, emotional stress being very different than physical stress, but biochemically, that's not necessarily true. There's still a stimulus, whether that is maybe a thought of a past trauma, or that is anxiety about an upcoming event, or just a generalized anxiety that you can't really put your finger on, or it's a heavy deadlift, or it's a sprint or something. A lot of those things are exerting the same effects on your body, i.e. increasing those cortisol levels real high, which are putting you in a stressful situation. Now, physical stress is one that we can control through exercise. And what happens is if we put our body in these stressful situations intentionally, a stressful situation that comes and then goes in the form of a 30 to an hour long exercise routine, intense activity, our body kind of acclimates to stress, and it kind of gets to practice for stress. And you can build some level of tolerance. So when you face mental, emotional, and psychological stressors, your body is already prepared to handle stress. It will start to clear some of those chemicals out more quickly. It becomes more accustomed to it. It builds this tolerance to stress. So that's one thing that we think is happening with exercise, is we're sort of building this barrier and increasing our tolerance to stress, whereas a lot of people don't have a very high tolerance to it. If they are met with some sort of psychological, emotional stressor, they can't handle it well. Well, getting that physical stress, planned physical stress, can increase that threshold. Additionally, exercise can just it can give you a sense of accomplishment. Just getting up, getting something done, even if it's not like a new milestone, just doing something, getting something done, can increase your level of self-efficacy, which is self-efficacy is you knowing that you are capable of something. And during bouts of depression, that's something that's typically very difficult for people. They feel like they're not capable of much. You don't feel like your self-worth is very high. Now, if you can make yourself do something, particularly something difficult, and achieve it, that can give you a sense of accomplishment that might build some momentum, that maybe you can push that into other activities to kind of feed off of that and keep increasing that level of self-efficacy, that self-improvement. Additionally, there was a study called the Hunt study that some people are more familiar with because it's a little bit older, but that showed that regular exercise actually helps prevent onset of depression in people that are not already depressed. Now, that's really encouraging and kind of speaks to what I talked about there as far as preparing your body or increasing your threshold for stress. Well, the prevalence, that study wasn't quite as large, but it was still pretty large. I want to say it was something like 30,000 people, where they showed that there's a 44% reduced probability of onset of depression in people that were exercising regularly, somewhere between an hour and an hour and a half a week, which is pretty low. That's even below the recommended amount. Even that was enough to prevent onset of depression. So, clear evidence. Again, 128,000 people studied here, and exercise is 1.5 times as effective as therapy and medicine. So what kind of exercise do you need to be doing? Well, the study showed that the most effective, any exercise is effective, but the most effective exercise is intense exercise, and not necessarily for a long duration. So remember, intensity is a relative term. If I go out and run a mile in 7.5 minutes, that might be the same level of intensity as someone who hasn't exercised in a very long time walking a mile in 14 or 15 minutes. Our heart rate might be the same. Our sense of exertion might be the same. So when I say intense exercise, that doesn't mean that you haven't really been active in a year, and for it to be intense, you got to go out and run wind sprints. That's not reasonable, probably not responsible, and additionally, you're not going to stick to it. So intense exercise, something that is really, something that's kind of a struggle for you, but again, for you. And additionally, in the modality of exercise, it was shown that resistance training is more effective than aerobic training. So actually going and lifting some weights, doing some sort of muscular development sort of training, so some sort of lifting, moving resistance is more effective than aerobic or cardio exercise, particularly for depression. Now, these studies also looked at anxiety, and as you might guess, one of the more effective ways to reduce the symptoms of anxiety were things like yoga, where there's more of a mind-body connection. A calming exercise was more effective for anxiety. It wasn't as effective for depression. Now, if you've experienced anxiety, you know that kind of racing mind. And so something like yoga, maybe Tai Chi, something along those sorts where there's a lot of focus on breathing, deep breathing, slowed breathing. Well, all of those can really, I probably shouldn't say trick, but convince your body that you're safe by having an influence on things like your hypothalamus and your amygdala to make your mind realize we're okay. Like if we're breathing in this way, we can't be being chased by the saber-toothed tiger, so we must be all right. But for symptoms of depression, which is really what a lot of people in the study were facing, that intense resistance training is going to be the most effective thing. Again, that's relative. If you haven't lifted a weight in 10 years, you're not going to go throw 225 on a bar and go do some bench press. You might get some resistance band or go get you some light dumbbells and lift some of those weights for a little bit. Somewhere around 30 minutes a day, 5 days a week is ideal. And you might think, this is always a thing where people talk about, I don't have the time or whatever it may be. If you've ever experienced depression or you know somebody that has, 30 minutes a day is well worth an improvement in your symptoms, particularly if it's an improvement of symptoms over what can be done with therapy and pharmaceuticals. Now, I think talk therapy is a great thing and can be great in conjunction with, a good exercise routine and an improved sleep cycle and an improved diet. But the pharmaceuticals are really hard on a lot of people. And, let's just look at some of the side effects of an SSRI, the selective serotonin reuptake inhibitor. Because remember, like I said before, serotonin does a lot of things in the body, just like norepinephrine. So if we try to start messing with that by artificial means, it's going to affect other things in the body. So things you can expect, side effects of SSRIs would be anxiety, appetite loss, insomnia, loss of libido, erectile dysfunction, difficulty achieving orgasm. Now, all of those things right there, serotonin is pretty integral in sexual health. So that's why we see loss of libido, erectile dysfunction, difficulty achieving orgasm, all the way up to hallucinations, bleeding bowels, and of course, suicidal thoughts. Always has been shocking to me that is a potential side effect of a medication that's supposed to treat depression. So, that's why not having exercise and lifestyle change involved in the treatment of depression seems so crazy, because there are the potential side effects that come along with these drugs, but there's really no side effects of improving your sleep, your diet, and your exercise. So it's something that has to be done. Now, it should be said that in a depressive state, the idea of exercise might be very difficult. This would be something great if you are dealing with depression and you are having trouble making yourself do things, which would not be unusual, to have a coach or to talk to your therapist about and say, look, this is something I think I need to be doing. I need to be held accountable. Can you help me with that? Or to go to a family member and say, look, I've got to start exercising. Will you start exercising with me to try to improve my symptoms of depression? Now, a lot of these studies were done with people with mild and moderate depression, just because at some levels, at really severe levels of depression, it could potentially be considered unethical to treat people only with exercise. Again, even though the results showed it's more effective than pharmaceuticals, if you have somebody that's in a very serious depressive state, it's kind of all hands on deck. We kind of can't wait to see what's going to happen. However, all of this evidence shows that this would help people in a major depressive state as well. And those people are going to have a harder time getting out of the bed and doing these things. But once it starts, it's a snowball. You can build that momentum. So be a great thing if you know somebody in your life that seems to be struggling, to try to get them to become active with you. Remember, exercise doesn't have to be going to a gym. It can be taking a hike outside. It can be playing a game that's physically active. It can be anything. But, just knowing that this is so important, not just your physical health, but your mental and emotional health as well. It just has to be so clear that exercise has got to be a central part of your life, no matter who you are. So these studies really they showed the duration, you're hitting maximum effectiveness within 12 weeks. That's really a short amount of time, particularly when you think of people that have been in depressive states for a really long time, that you could start feeling effects immediately. Now, remember, we want these exercises to be intense. So if you're a really deconditioned person and you start exercising and you're getting more and more fit, you should try to up the intensity of your exercise. If you start out walking a mile in 15 minutes and that's really intense for you, well, 3 months from now, we shouldn't still be just walking a mile in 15 minutes. You should be able to speed that up. If you started off with 10-pound dumbbells and you did 4 sets of 10 on that, you just did some arm raises or some curls or something like that, some shoulder press, just to get you started off, and that was really intense for you at the beginning, 3 months from now, we need to be doing more than that, because it still needs to be intense. You're going to acclimate to whatever level of activity you're doing, and it's going to, in a sense, if you're doing the same thing you were doing 3 months ago, it's going to feel easy. So we got to increase that intensity. So not only are we improving our mental state in that, in that situation, you're also improving your physical strength and endurance and overall physical health. So I do think this information is extremely encouraging. I will put a link to this in the description of this video. But if you are working with a therapist or a physician that is helping you with depression, and they aren't telling you that you have to be exercising, bring this study up to them. Talk to them and go, hey, look, it looks like, exercise is actually more effective than just medication. What can I do? I think that's a totally reasonable thing to do. And any physician that would discourage you to be physically active to help with your depression, you might need to shop around for a new doctor. So I appreciate you watching. If you have any questions for me, please let me know. Like, comment. If you like this type of information, subscribe. Check out some of my other videos. And hope you feel better. Look forward to talking to you next time.